Hey guys, welcome back to the channel. Hope you guys are doing good. In this video, we will discuss the anatomy of zygomatic bone. So without wasting any more time, let's get started. Starting with the general information. Zygomatic bones are the two facial bones that form the cheeks and the lateral walls of the orbits. They are also commonly referred to as the cheekbones. Each zygomatic bone articulates with the temporal bone, frontal bone, sphenoid bone, and the maxilla. Let's have a look. This is the anterior view of the skull, and this bone shaded in the orange is the zygomatic bone. Now, let's discuss about the surfaces and processes of the zygomatic bone. There are three surfaces and three processes. The surfaces include the orbital surface, temporal surface, and the lateral surface. And the processes include the frontal process, temporal process, and the maxillary process. We will discuss each of these separately, starting with the surfaces of the zygomatic bone. First is the orbital surface. The orbital surface takes part in the formation of the orbital wall, and there is a foramen present on this surface called as the zygomatic or orbital foramen. We will discuss more about the foramens later in the video, but for now let's take a look at the orbital surface. This is the anterolateral view of the bone, and this is the orbital surface which takes part in the formation of the orbital wall. This is the zygomatic or orbital foramen. Second surface is the temporal surface. The smooth posterior surface of the zygomatic bone faces the temporal fossa and is called as the temporal surface. The temporal surface bears a foramen called as the zygomatic or temporal foramen. Let's have a look. This is the posterior view of the bone. This smooth surface is the temporal surface. And this is the location of the zygomatic or temporal foramen. You may wonder what this mark is for. In order to understand that, we need to discuss about the third surface, that is the lateral surface. The lateral surface is shaped like a 4-point star. It is smooth, convex, and faces towards the outside. The lateral surface also bears a foramen called as the zygomatic or facial foramen. Let's have a look. This is the lateral view of the skull, and this is the lateral surface of the bone. This small foramen which you can see is the zygomatic or facial foramen. Coming back to this mark. So this is nothing but the opening of the zygomatic or facial foramen on the posterior surface. Before discussing about the processes, let's summarize the foramens. The zygomatic or orbital foramen is on the orbital surface and it leads into canals. These canals open on the lateral surface by the zygomatic or facial foramen and on the temporal surface by the zygomatic or temporal foramen. The function of these canals is to allow nerves to pass through. Now, let's discuss about the processes. First is the frontal process. The frontal process articulates with the zygomatic process of the frontal bone and the greater wing of the sphenoid bone. Let's have a look. So this is the frontal process. And this is how it articulates with the frontal and the sphenoid bone. Next, we will discuss about the temporal process. Temporal process articulates with the zygomatic process of the temporal bone to form the zygomatic arc. Let's have a look. This is the temporal process, and this is how it forms the zygomatic arc. Lastly, we have the maxillary process. The maxillary process articulates with the maxilla. Let's have a look. This outlined process is the maxillary process, and this is how it articulates with the maxilla. Let's have a look at all the processes. So that is it for this video guys. Don't forget to subscribe the channel and follow us on Instagram. Links in the description.